Good evening, good morning, good evening, good afternoon, everyone. That's just because we are in different time zones. By the way, my name is Tapan Tabani, your Yalda, Southern Africa Regional Associate. I'll be co-moderating today's session with Anastasia. She's a counseling psychologist, and it's a pleasure to be moderating this lovely session with the whole team. Thank you and our speakers once again. Just some few ground rules. When you enter the webinar, make sure you're on mute. Remain remain on mute until we are done with the session. Ensure that your camera is off. We need to respect everyone else data's consumption, as data is very expensive in Africa. Type all your questions in the comment sections in the chat box. Oh, and remember to put your name and country. Because we as Yaldi, we're quite a diverse group. We are in 37 countries and in all continents. So yeah, so we are quite diverse group. So just the last ground rule, those questions or comments will be selected, and once we have selected your question, we'll definitely ask you to unmute. And if you're asked to speak, you must introduce yourself by name and country only, as just to save on time. Yeah, once again, on this World Health Day, we urge African governments, humanitarian actors, donors, and civil society to act with urgency and coordination. Governments must embed mental health fully into disaster prepared, prepared, uh, in terms of preparing for disasters and response, protect dedicated funding and strengthen primary health systems so services are resilient in the face of shocks. Humanitarian agencies should scale culturally sensitive psychosocial interventions and pair immediate support with pathways to long-term care. Donors need to invest in sustainable, locally led programs and digital infrastructure that maintain care continuity when access is disrupted. Communities, families, and youth must be resourced and trained to provide psychological first aid, while stigma reduction campaigns must be sustained so that seeking help is normalized and safe for everybody. World Health Day 2025 reminds us that emergencies magnify inequalities, but also expose opportunities. When mental health is prioritized as part of emergency response, lives are saved, recovery is accelerated, and societies rebuild with greater resilience. Africa deserves systems that protect minds as fiercely as protect bodies. Yalda stands in solidarity with every young person facing trauma, displacement, or loss, and will continue to work so that in every catastrophe, mental health services remain accessible, inclusive, and rights-based. Together, let us ensure that no mind is left behind. We would like to just recognize Dennis Joanna from Kenya and uh, Chepagentic from Kenya. As I said, we are quite a diverse group, so yeah, the names might be tongue twisters. Just to begin this exciting webinar, I ask all of you in the audience to type in the chat your name and country. Thank you so much. Anastasia, you can take it from here. Okay, so probably she's still trying to join in. Let me just shortly introduce our speakers. We have Dr. Kabuga. He's a medical doctor and health zone coordinator at FHI 360 in the Democratic Republic of Congo. We have uh, we have Rim Raudi. She's the managing director of Main Gate Agency Corporate Wellbeing in Morocco. We also have Dr. Vivek. He's an executive coach, corporate trainer, and a psychotherapist, founder, and chief counselor Pal Wellness in India. We have James Wetu. He's a CEO and co-founder of Convo Africa. He's from Kenya. We have Herman Manuel. He's a psychologist and mental health consultant from Angola. We have Dr. Kabasele. He's managing director. He wears very hats, but mostly he's a champion of mental health and global health equity in the Democratic Republic of Congo. So we're gonna just kickstart. Just so that we save on time, each person will be allocated, each speakers will be allocated some time to go through the questions, and yeah, just for us to speed up the process. Let me start with the questions and then I'll throw it to the floor. So let me just do this. Sorry, I'm just changing devices here. This one doesn't have adequate battery. Okay, here we go. Our overall question that speakers will be addressing: mental health challenges often intensify during crisis, yet access to services remains limited. From your perspective, what can governments and organizations— Sorry about that. From your perspective, okay, let me just reread the question. Yes, I was just having an interruption here. Mental health challenges often intensify during crisis, yet access to services remains limited. From your perspective, what can governments, organizations, and communities do to ensure mental health remains a priority in times of catastrophes and disasters? So we'll start with our first speaker. We'll start with Dr. Kabunga. So you will have around 3 minutes, and then after 3 minutes, we'll just continue to the next speaker. So here is your question. Probably let me make it more direct. What's your take, Dr. Kabunga, in your work in DRC there? What challenges do you face in terms of also mental health in crisis? Yeah, you can take it, sir. Thank you, Doctor. Dr. Kabangu?
Okay, thank you. Can you hear me, please?
Yes, I
Hello?
can hear you, Doctor. I can hear you.
Okay,
Thank you.
thank you. Just to introduce myself quickly, I'm Dr. Hervé Kabangu. I'm a medical doctor working at FHI 360. I'm working in HIV service. And for answering to your general question, I think we have to have a understanding of humanitarian emergency to know that humanitarian emergency, whether caused by conflict or natural disaster or industrial accident, disrupt lives and dismantle system. And answering to challenges or challenges where we are facing in Republic Democratic of Congo is we notice a severe shortage of trained mental health professionals. The number of qualified mental health workers is drastically low in many crisis affected regions where the need of service is too high. This is the most challenge we've got in our country. As you know, the eastern part of our country for over 30 years is facing with this war against our country, DRC, and Rwanda, Uganda, and Burundi. You know, this is crisis region. We have the first challenges, as I mentioned, the shortage of trained mental health professionals. And to take a detour from there, we have also a capacity limitation of existing healthcare system. I can also mention the second challenge we are facing is the widespread of stigma and lack of knowledge about mental health. So we are facing with negative perception of mental health illness, and that is creating barrier to seek help, and it can lead to discrimination. And the focal point or the main point is social and cultural norms. In many communities, there is a cultural expectation of resilience and self-reliance, and finding people discussing about emotional difficulties is often seems or seen as a stigmatization, and mental health problems may be viewed as a weakness, and in some contexts as a spiritual falling. As you can find, if someone is facing with mental health problem, um, religious barriers can be found as someone is being attacked by demons for pastors and other believers. That is truly a big challenge in general context. And we have also a misinformation and fear. The lack of basic understanding about mental health can lead individuals to misinterpret symptoms and character that flows. And people may also feel a judgment from family, from friends, and even healthcare providers if they disclose their struggle. And the last point I can mention is uh, is is truly linked to our way of coordinate service as an organization, non-governmental organization. The response we brings to people are often reactive and in short term, which can lead to fragmented and unsustainable mental health program. So a short-term focus in our response creates a problem instead of bringing solution. You know, when we have crisis situation, like war, like a disaster, we bring a short-term response because it's due to funds and other contexts, and the lack of integration. Mental health is not integrated into primary care service. These are things I can mention for starting. Thank you.
Wow, thank you, Doctor, for actually sharing that. So I guess you're emphasizing the fact that mental health should also be included in primary healthcare in terms of crisis, as you have witnessed in your country that some of those challenges arise.
Sorry. I don't know if it's at my parts. I've got difficult to catch you, please. Sorry. I don't know.
Okay, can you catch me now? It's just that it's raining here. The rain is falling very hard. So probably some of the things might be my voice might be disturbed. So I was just saying to summarize what you just said, you're actually emphasizing the fact that mental health should be prioritized in terms of aid or humanitarian aid in terms of crisis as you witnessed in your country, and also cultural expectations also contribute to some aspect of also some cultures believe that or some don't also take either crisis or such disruptions as seriously as they should. So if also we incorporate mental health, it also allow probably interventions to be achieved in such crises, and probably because some cultures are slow to catch up. For instance, some don't have access to either a disaster or tools, so it will be quite uh, crucial to also incorporate cultural leaders. So, wow, thank you for that perspective. Just so that we could take note, our next speaker, it's been she's in a meeting that we have somebody who will be taking in her story. She's Malek. She's a wonderful speech therapist and Jen that hosting a podcast on mental health.
Fan, your voice is breaking. We cannot get you clearly. Your voice is breaking. So it should Rim was replaced by Malak. And Malak is you can see Malak from
Yes,
the Malak.
here.
Yeah, yeah.
Yes, I'm here. So I will be representing Rimraudi because she couldn't make it for today.
Okay.
And just to introduce myself, I'm a speech therapist and a mental health consultant here in Morocco. So to answer to the question is when a crisis strike, whether it's a natural disaster, pandemic, a social emergency, the word focus on
Malak, will you please
rebuilding
turn
the
your video
homes.
on? As you only have the picture of Rim here, so we request you turn your video on.
Yes, of course. Yep. So as I was saying, is when a crisis strike, whether it's natural disaster, pandemic, or a social emergency, the word focus on rebuilding the homes, distributing the food, and restoring. But what about the hearts and minds? In that, if we see it from that side, like here in Morocco we have seen a lot of catastrophe, but the invisible wounds, the psychological ones, are often the deepest and the longest lasting. Like, for example, just after the earthquake that we had a few years ago, it was was not just about ground that shaked, but it's more about people's sense of safety, their memories, their dream. They all tremble too. Yet, even in this moment, mental health often remain the second concern. Services are limited, professionals are few, and the stigma keep many from seeking help. The truly protect our people, mental health must become the core part of an emergency response after, not after a thought or being asked to see a specialist or to go to ask for that kind of help. So the government have that crucial role to play to support that mental health and integrate it into a national crisis plan with a training psychologist, social worker that presents in a relief plan with a training with a training psychologist, not only doctor and injuries and engineering. So right now we see that youth are getting more, how to say, but more conscious about what's happening and about mental health. But it's still a stigma in our country. We have a real difficulty to talk about our mental health and asking for a psychological uh, aid for youth. And we see that organization work on this side, work on breaking the stigma, on helping youth to express themselves, to give a safe space where youth can have a space of dialogue and giving some volunteering trainings for people and support that basic and giving that basic psychological support. The most important is we must remember that mental health is not a luxury, it's a right. It determines how we recover, how we rebuild, how we move forward after a tragedy or after a trauma, or is that something that can happen that is really hard for us to support. If we want resilience to be real, not just a word, but how to say it, then our response to every crisis must heal, but the body, but also the mind, the heart, the soul, that help us to regain that joy that we came from the beginning. Because no nation can truly rise again if her people are silently falling apart from inside. So I really believe that the work that we do in this side on trying to break the stigma about mental health, talking about it, giving safe space for dialogue and training people just for the basic of psychological support, giving them the knowledge, the basic knowledge that they can have to work on this side. I guess it's a first step we can do. I know that it's not really easy to talk about those things and to give all the support, and but we do what we can to do as a person, as someone that believe on her country, and from that someone that believe on when youth work hand on hand, they can change a lot. So for me, the first thing that governments have to work on is to integrate the national psychological first aid to work on all that. So that's it for me.
Thank you once again, Malik. I believe this time around audible.
Mhm.
Okay, thank you for the fact that really urgent for government to incorporate the national mental health first aid, because
Mhm.
really common in Africa that some frameworks are not really available for people or for organizations or response teams to use, because some really don't even have an idea of in such crisis. For instance, you might find out the crisis is quite new,
Mhm.
as has happened years back, and for this generation that's now in charge and taking leadership, it's quite a challenge for them. But if the governments or countries have that national framework, it means that it would also incorporate the historicals of either the disruptions that they had. So wow, I really never didn't look at it in that perspective. So it's quite important that government and everybody involved sit down and create those policies. So
Mhm.
going on to our next speaker. So whoever has questions can throw them in the chat box. So we're gonna have Dr. Vivek. Dr. Vivek, based on probably your work as a counselor and also psycho therapist, probably what's your take on mental health also being incorporated in humanitarian aid, and how can governments, communities, and all stakeholders help in facilitating that also people or the victims of such or the recipients of humanitarian aid are actually well adversed in terms of mental health challenges and disorders. Thank you. The floor is yours, Doctor.
Sure. Firstly, thank you to Yalda and Spring of Joy for bringing us together today. When we talk about crisis, whether they are wars, pandemics, or natural disasters, uh, they don't just take lives, they take away people's sense of control and emotional safety. And while food, water, and shelter are visible needs, mental health is the invisible one that determines how people recover and rebuild. So, governments must treat mental health as essential infrastructure, not as an afterthought. That means embedding psychosocial care within every disaster management plan alongside medical and logistical response, and training frontline responders. I recall Dr. Kabangu and also Malak, the earlier speakers, talking about not having enough mental health professionals. So the frontline responsible responders in psychological first aid, protecting budget lines for community counseling, or integrating mental health services into primary healthcare are practical steps that can save lives long after the headlines perhaps fades. And organizations such as NGOs, corporates, or humanitarian agencies can ensure continuity by creating mental health task forces that stay active between crises. They can fund digital helplines, mobile clinics, and also peer support programs, as Malak mentioned, that scale quickly when access is disrupted. Even workplaces, have a role to play, maintaining trauma-informed leadership and offering employee assistance during, and after emergencies, help stabilize communities economically and emotionally. But most healing begins locally. Going back to what Dr. Kabango mentioned, communities are often the first and the last responders. When we train faith leaders, teachers, and youth volunteers primarily to recognize distress and offer basic emotional support, we multiply the reach of care. Culturally rooted approaches like storytelling circles or mindfulness circles and body-based therapies help people process trauma in familiar and safe ways. So these grassroots systems can keep mental health conversation alive long after the formal aid really moves on. So if government provide the structure, organization provide the resources, and communities provide the soul, then mental health will never again be sidelined in a crisis. Because um, as Malak really mentioned about how people fall apart, um, rebuilding a nation means rebuilding its people. So I would end my time with saying, mind first, then matter. Thank you.
Okay, now I have some few key takeaways, Doctor, there that we firstly have to rebuild the people, we're rebuilding the nation. And wow, thank you, Doctor, for that. And uh, so we have we have James Wetu. James Wetu, probably just your take on mental health in humanitarian crisis and which urgent steps or strategies should governments, communities, and either all stakeholders involved do in order to make sure that while we are rebuilding our nations, we are also rebuilding the people. Thank you. So you have 3 minutes. Oh, yeah.
Okay. Thank you so much. So I want to I think I've had quite a good discussion from Kabangu, Malak, and Dr. Vivek. I feel the government has quite a lot to do. And I think what we need to have the government do, especially, is to integrate mental health into disaster preparedness frameworks. It shouldn't come as an afterthought. I think Malak had mentioned that. But we shouldn't think we need a mental health personnel. It should be integrated. Uh, all national disaster management policies need a very explicit mental health provisions with a very dedicated funding. And then again, should be able to reposition, psychological first aid teams alongside medical responders. Most of the time, you find that there's food, there's water, there's everything, but there's no psychological first aid team, the team that are going to help. And we've seen it working. So it's something that is doable. We need to integrate mental health into all disaster preparedness framework. Very important. I want to echo what Dr. Beck has said about the training. I think organizations, NGOs, and in Kenya, we've seen Kenya Red Cross, for example, and I know this is cut across Africa and other Red Cross offices. They have shown how peer support models can be deployed when they are well trained. We have so many health workers. For example, in Kenya, we have a team we call community health promoters. I think every county in Kenya has almost 100 of them, but they do not have the skill or the know-how, the psychosocial. They're not able to offer psychosocial support because they have not been trained. So training forms a part of, something that the government organizations can be able to do, because like Vivek is saying that these are the first responders. They need to be trained how to respond to people who are traumatized. So training becomes critical in this whole game. And lastly, something that is quite alive in Africa is what we call the Ubuntu spirit. I think it's still very alive in Africa, and we need to leverage on our community strengths. In Kenya, we have something we call Balaza. Balaza is a Swahili word just to mean forums, and they usually happen at the community level. It's the area chief calls the members of that community for a briefing. And I think that is a very good platform if it's well done, because if it's quite structured, it can offer space for collective healing within a community, and as well as a platform where people can be trained on mental health. I echo what Dr. Rebecca said, that religious leaders, community leaders, these are the people majority of the community members turn to when there's a crisis, and therefore they need.
James, I don't know if it's probably your line that cut, although I think your time is up. Thank you so much. I've learned a new word, balaza, which is very important that we also incorporate our chiefs at community levels, because they know and understand the problems that each community members faces. So wow, that's also a great take. So yeah, I'm learning some Swahili today. We're going to our next speaker. So our next speaker we have Manuel. So Manuel, probably you could just follow in line what the question that, or how can either professionals like you as a health consultant, also how probably from your perspective, how can humanitarian aid include mental health? So yeah, you could just start there. Your 3 minutes starts now, and probably yeah, I'll raise a hand once it's up. Thank you.
Thank you for the opportunity to talk to this conference, and thank you for the opportunity to represent my country in here. And I would also like to give you the congratulations to bring this important matter into the table, because we need to talk about more mental health. Going directly to the question you asked me to, it was said here that when humanitarians emergency occur, it just don't have to do with conflicts and natural disasters. And there's also something that we call psychological emergencies, because these people don't lose just their resources, they lose families, they lose their hopes, they lose their connections and sense of safety. So in these moments, that's when young people mostly steps in, not only providing physical help but also providing psychological support. And across the Africa, we have seen some good initiatives. We have seen some young leaders leading some discussions, sharing some important information on social media. But the most important thing, they actually use their influence to talk about important matter. Uh, they use their influence to talk about emotion and resilience. That's something very important. And even with this kind of, just we might say as well, simple action, they do something very but very important. They use their faces, they use their ability to break the stigma, and that's important matter. In Angola, for example, we have a little problem with mental health. We still face some resistance to insert the psychological support in our services. There is so many people that thinks that when you seek the psychological support, you might be sick or you might be having a big problem. So there is still a lot of work to do. I think it's not just in Angola, but it happens in most of the African countries. And when I see a young guy, using their leadership and starting normalizing conversations such as mental health, the conversation in churches, in universities, and other places, I think that that's the way that we can use to change our mindset. And so that's the way we need to keep going. And this way might lead us to send a clear message that seeking the psychologist is not a signal of weakness. It's a signal of courage and self-awareness. And in the end of the day, I think that to break the stigma is not about just bring up one project or one campaign. It's about transforming the culture of silence into culture of care, social care mostly. I don't want to be repetitive. I would like to stop here and wait for the question next. Thank you for your time. Thank you for the time to talk to you.
Thank you, Manuel. I just love how you guys are doing it in Angola as the youth taking leadership in terms of being the voice and being the ones in the front line, spreading the word of how significant mental health is for countries. And yeah, so thank you so much. Yeah, we, we are moving on to our next speaker. And I love how everyone is keeping the comment section busy. Have your questions in there. Keep sharing. And we have Dr. Kabesele. Yeah, Dr. Kabesele dealing with either or being a mental health and global health specialist and a champion in that regard. Uh, what's your take on the subject or the topic that mental health should really be prioritized and frameworks should be implemented? All stakeholders should be involved. Also, as an expert on probably what's your perspective? Thank you. The floor is yours. Your 3 minutes. That's now. I'll probably clap hands once you're done, so that we could just save on time, because it's gonna be a long session and very insightful. Thank you. Your 3 minutes, that's now. Hello, doctor.
I think Dumas has not joined yet. We can maybe proceed to the next part.
Okay, hopefully when he comes back, he'll be ready. So probably we are going to start with some few questions. I don't know if there are any in the chat box, but because RIM has a representative, Malek, so this will be directed to you. Malak, yes, this will be directed to you. Young people often take the lead in supporting their communities during crisis. How can youth-led initiatives help break the stigma surrounding mental health and encourage others to seek help?
Okay, as I have been saying that in a moment of crisis, young people are not only helper, they are innovator of empathy. They use a lot of ways to create a space that can be related to well-being. Okay, so they bring a creativity and authenticity and digital intelligence to cause the older system often overlook. When it comes to mental health, Moroccan youth, we are reshaping the conversation the way the previous generation couldn't do. Instead of lectures, medical jargon, they use art, storytelling, technology to make mental well-being relatable and human. And we see that the youth-led initiative can take many forms, like photography exhibition about resilience, podcasts, projects about mental health, where students can talk openly about anxiety, or a social media challenge that turns self-care into shared act of courage. Their initiative work because they speak to the emotional language of young people, connection, expression, and belonging. So I'm gonna talk to you and tell you about a project that I'm leading within Global Shaper Mohammedia. It's an organization that is a part global shipper community. We have a project about breaking the stigma about mental health that called Glissa Binatna. It's a project that work around mental health, that give youth a space to talk about themselves and um, give them that space, that safety that can help them in a psychological way to speak through what they are living. Like an example for another activity or thing project that we have been doing with Global Shapers Robot Hub. So we had an initiative that we opened a space on social media for people to share their struggle, their problems, their traumas, so they can speak from themselves without shame, with giving them a privacy, like total privacy, like the name is not shared, the face is not shared, so they can talk and express themselves. So, from a psychological point of view, this influence play a powerful role when you person sees other on their age sharing the struggle. It reduces the shame and increase the perceived safety. And there are two key factors in encouraging help-seeking behavior. In society where mental illness still associated with weakness and instability. Their peer lead can normalize how we say it, vulnerability and reframe this trait. But there's a true power lies in modeling empathy by silence to each other without with like by listening to each other without judgment, by organizing dialogue cycles, by choosing compassion over silence. Young leader creates a ripple effect that challenge the stigma, not through the confrontation, but through example. And this essence that every youth led this initiative become from a quite revolution, a reminder that change doesn't always start with a policy. Sometimes it starts with a conversation between two people who dare to be honest. And in Morocco, that honesty spoken by its youth might just be the first step toward generation that heal differently and love louder. So that make us able to speak and start that change from every single person that had that courage to speak louder about how he feel and how he's living those traumas that he have. So this is very important to talk about it and talk louder about mental health and seeking that help when you need it as a person. Because when we talk about mental health, we talk about all the things that come true. We talk about health, physical and the physic and the mind, the heart, the soul. So this is really important. So thank you.
Wow, thank you, Malak, for that great perspective. And I love how you guys are just turning, when life gives you lemons, you guys are turning it into lemonade through incorporation of technology, social media platforms that keep everyone anonymous, that allows someone to break their silence. Because as probably youth or some people are comfortable just talking to a stranger behind a screen
Yes.
instead of be physical. So wow, I just
We are
found
really in the project. We are really strict for keeping the privacy of each person that ask for help or try to talk about himself or about his problems. We are really strict about that because we know that in our society it's a taboo to talk about mental illness.
yeah, true, affirmative.
It's really sensitive as a subject. So for the well-being of the person, we really try to protect as much as we can. So thank you
Okay.
so much.
Thank you, Malak. Probably for now, because yeah, it's been quite insightful and a lot of information has been shared. I'm just gonna call Mind Gaze, the online therapist. So yeah, you can take it, Mind Gaze, and then we just have a breather.
Hello, everyone.
Hello, you can hear?
I'm just checking if I'm audible.
Oh yes, you are. You are. We can hear you. Thank you.
All right. Unfortunately, I cannot use my video at the moment, but I am Botelo and I'm representing Mind Gaze, an online mental health platform that is making therapy accessible for Africans. So our goal was really to honor Mental Health Day and Mental Health Month as a list of our therapists are donating some sessions to attendees of this webinar. So we will just be sharing a link on the chat, and if you are interested in accessing therapy, you will be able to get an email once you register where we will give you details on your complimentary session.
Thank you. So we have some gifts for you guys. So just click on the link in the chat and then sign up, and you'll get your sessions with the great team from Mind Gaze. Once again, thank you for the complimentaries. So probably just to get on to our next speaker, James. This one is really for you. How can African health systems be strengthened to integrate mental health support into emergency pre- uh, preparedness and response plans? So basically, just how as African health systems, because we also have the traditional and we also have the modern, how can they probably be incorporated in order to solve uh, the problems and prepare for crisis? The floor is yours. You have 5 minutes. Thank you, James.
Thank you so much. I think the continuation, I think one of the things that we need to do, we need to look at the policy and the governance level. The governance level. I think we need to have mental health written into the DNA of our management frameworks. Psychosocial support should be a core pillar alongside medical care, water and shelter. And this should be operational. We should be in a position, or we should be able to stock psychosocial materials and ensure supply lines for essential, like psychotropic medicine. They're all mapped into emergency logistics. The other thing that we need to do for our health, in terms of response, is that what I would call workforce transformation. We cannot always wait for psychiatrists who don't exist in sufficient numbers. In Kenya, I think we have 110 psychiatrists serving a population of almost 50 million, So that means one psychiatrist is to 500,000 people, half a million. So what we need to do is we need to start task shifting our reality and strength, train our health promoters in the community. And this is something I had mentioned earlier, and train them in psychological first aid. Equip clinical officers in all rural health facilities with basic mental health protocols. And we saw this during the COVID, how quickly, frontline workers could deliver mental health support when given simple, practical tools. So this is something that we can do. And we know we have what we need to do is to amend the mental health and the psychosocial support, what we call MHPSS, into a national emergency preparedness in our healthcare sector. The other thing that we need to do is that we need to, what I would call technology as a force multiplier. I think right now in Africa, we have a mobile penetration. A lot of people are able to access internet on their gadgets. And what we need to do now, we should be able to lead in mobile mental health. And I've had Mike Gaze, they're doing something online, we can deploy SMS-based mental health check-in, post-disaster, telehealth consultations for remote areas. We can have AI-powered chatbots for initial psychological screening. And for us as Convo, we're also focusing on that, providing digital approach to mental health, and is demonstrating that this is a huge potential. The other thing, and maybe just to add on, is how we can build up on our community-centric models. Our community structures, as they are existing, it's a very good structure for mental health infrastructure that we have really overlooked. We have village elders, we have women groups, we have youth groups, faith communities. We need to formalize their role with the training and supervision during crisis. And why this is very important is because sometimes they're the first contact in our community. So these are the people who will interact with some of these people who are struggling, for example, and the people who can be able to take them to a psychiatrist or a psychologist, or in this case, therapy or even a hospital. So we need to infiltrate the community-centric model where we're empowering these communities, to be able to take some action. What I'm saying is we should be able to systemize this approach. And the other thing that I feel is very critical is to what we could say data and surveillance systems, which we need to create. We need to integrate mental health indicators into our existing health information systems. We have maybe in Kenya, I think we have something we call DHS platform. And I think most countries do have something that they use to track disease outbreaks. We should be able to add mental health surveillance into these platforms. When floods hit, we should monitor not just, cholera cases, but also we should be able to monitor depression, anxiety, PTSD, symptoms in real time. So that is important because it will advise and will help even know how to intervene and how much resources that is required to intervene. So that's maybe just to add something maybe onto that is the issue of financing. And I think we need to improve financing because I think most of the healthcare systems in Africa are quite underfunded. If you look at the mental health budget, for example, a country like Kenya is less than 1%. I think we need to be able to finance healthcare infrastructure to be able to support mental health. And as we even integrate MHPSS, we need to have a budget line to that. And finally, and this is something we said that mental health need to be integrated in all primary healthcare structures. So yeah, that's my take on that. Thank you.
Wow, thank you, James. So I hear you emphasizing the fact on capacity building, having a budget, because really 1% is not adequate to serve a population the size of Kenya. Secondly, also I'm quite shocked on really the ratios of the medical aspect to the patient. It's really quite huge that such few experts are serving such a large population. So moving on to our next question, uh, we have our next. This one is directed to. Sorry, let me just. Oh, yeah, found it. So this one is directed to Dr. Kabangu. So this is just based on your personal experience. Working in crisis zones presents unique challenges. What have you observed as the biggest barriers to providing mental health support in these settings, and how can organizations overcome them? Thank you, Doctor. The floor is yours. Your 5 minutes starts now.
Okay, thank you, and thank you for other speakers. It really it really interests. Yes. For this question, I think at my first intervention, I've already mentioned some barriers, and I said shortage of trained mental health. A shortage of mental health professional. I've mentioned it, and I also spoke about a widespread of stigma as a barrier and inadequate and a poorly coordination of service that really is related non-governmental organization. And what strategy to overcome the barriers? I can finish by this point. The first strategy is to adopt a task sharing to build a local capacity. The organization can scale up service by training non-specialist health and community workers to deliver evidence-based psychological intervention under embed supervision. On that, I see to empower local staff to train health workers, teachers, community volunteers in basic psychosocial support and psychological first aid. This leverage existing community and connection and create a sustainable and local workforce. And to have in mind that we have to use a basic protocol. We have mentioned it, an MHS gap that the World Health Organization provides. We've got all literacy. We have to vulgarize it, to speak about it at school, university, in church communities. We have to vulgarize all literacy we've got. And the second approach to overcome these barriers is to destigmatize mental health through community engagement. There I see approach to create a culture of acceptance and encouraging help seeking. We have to involve trusted community members to work with religious leaders to spread awareness and frame mental health in our culture. We have also to, I think all speakers have agreed with that, is to integrate mental health in our primary care system. And the third thing I can add is to integrate service and to use remote technology. I think you have mentioned it too, to use technology, to use social media to promote mental health problems. And at the end, we have also to advocate for sustained funding and policy change. As you know, is to build a resilient system. The government must put in place a resilient health system that is independent of international health. If you're working in international system, you have to know that in January, when the president Donald Trump took place, he stopped all international aids. You know, over 80% of aid international has been cut, and our countries are facing with a great challenge of supporting HIV, TB care, and as in my country, we are facing with war. We don't have a budget plan or to support mental health and others system. So as I say, government must put in place that resilient system that is truly independent of international aid, and to look a secure long-term funding.
Personally, think it's a bad idea.
Sorry about
okay.
that. Who
Okay.
Yes, you can continue, but your time is almost up. Just kindly wrap up. So.
Yeah, okay. I'm just going to let my take-home message is that in many African society, boys or girls grow up learning that strength is silence, that men must never falter, never weaken, never feel anything. And vulnerability is seen as something to hide or to hell. So when health struggle arise, men often retreat in a world. They try to fix themselves in isolation, believing that asking for help is a weakness. But this silence, it doesn't protect them. It isolates them. It depends the pain, and it often leads to a tragedy. Um, so the true silence is the true strength is not a silence. It's the courage to speak, to seek for help, and to heal. We must rewrite the narrative, saying that strength is emotional honesty. Resilience is knowing that when you resilience is knowing when to lean on others, and manhood includes mental health essays. So also as a part of an international non-governmental system, we have to integrate population in our service providing, having in mind that anything you do for us without us doesn't concern us. So let us build a space where men can talk without shame. Let us train provider to listen without judgment. Let us show that healing is not betrayal of masculinity or femininity. It is evolution. And also appreciate this platform. We see that we are taking out this problematic of mental health as we can speak about it, and people can get information about what it means. So I think one of one of the speaker I said it. Mental health is not a luxury. No, it's not a luxury. It's something that we can just manage and help each other to overcome it. Thank you for your invitation. Thank you.
Thank you, Doc. Thank you once again. Really, it's very important that we incorporate all these frameworks and all these ideas, because this, what you just shared, reminds me of South Africa, which is probably one of the countries that invest mostly on mental health, because it allocates around 5% of its budget. And the likes of Ghana, it's a good example, because for every $7, it spends $1 dedicated to a patient of trauma. So in terms of capacity building, it's really important that we invest in capacitating those health workers, the people on the ground. Just to go to the next speaker. Our next speaker, we have Manuel. So yeah, and also kindly remember to share your questions in the chat. So Manuel, your question here goes: young people often take the lead in supporting their communities during crisis. How can youth-led initiatives help break the stigma surrounding mental health and encourage others to seek help? Thank you. 5 minutes. That's hello, Manuel.
Okay, I'm here. Thank you for your opportunity to speak to you again. As I said before, it's an important platform to talk about mental health. And when we talk about mental health, actually, we are not talking about how to show how to demonstrate weakness. We actually are talking about how to build a resilient people, how to build a resilient person, and how to achieve our goals as nations, as country, and as continent as well. So it's important to invest. And I saw a question in the chat: how much our governments are investing in mental health? And I can see that we are investing a low budget in mental health, and that means that we are doing bad in that particular situation, because when we don't have mental health, we don't have social health, we don't have uh, financial health, we don't have enough to build a integrate society. In my country, in Angola, mental health is not a priority. We don't have psychologists integrated in basic systems such as education, such as uh, university and church and so on. We mostly depends on private initiatives such as companies, NOGs, and so on. And I would like to enlighten a project we call Psicologia na Banda in Portuguese, but is also psychology in the blocks. For we can translate in these words. Uh, a group of young guys just unite them and create a project that goes to the peripheral areas and talk to uh, childrens, and they create I don't know if you know about capoeira. Capoeira is a style of fighting, but the primary goal is not fighting, is how to defend ourselves from the adversities. So we don't actually attack, but we use some techniques to defend ourselves. And they made a analogy between defending themselves from physical situations, from defending themselves from psychological situations. So they used to use capoeira as a tool for mental coping. So I think it is important because it's one of the tools young guys can use to like the mental health necessity, and we can use other tools such as social medias and so on. So the most important thing is to talk about mental health and understand that mental health is not a luxury, as we said before. It's a necessity that we all have, and we all need to understand that without mental health, we don't have another health in the end. But I would like to highlight two more points. The first one is due to investment. The government might need to have a budget to mental health. We need to stop. We have to stop depending from the others to take care of our mental health and our things in Africa. It still depends a lot of international initiatives. We need to build our things. We need to incorporate our effort in our activities in order to have independent systems. And our system is one of the most important systems that we can build on. And other thing we need to do is to offer some, not just training, but also recognition for the young guys that creates things that empower our youth. Give them some awards. We used to give some awards for the musicians. We used to give some awards for the actors, but we need to recognize the people that usually do things that impact positively the way people think about the world. So uh, I would like to finish with this take. that mental health is important matter, and we need to prioritize them and not just prioritize the physical health. Thank you for the second time to give me to.
Thank you, Manuel. What you just shared is quite something I can relate to because I myself dealt with mental health by doing Kung Fu. So capoeira is one of the most disciplined martial arts by Brazilians there. It's more of like we're dancing, but we're still fighting. It's more of expression. It's containing everything and just being one holistically with yourself, with your environment and everything. So, and also I just love how we are integrating various ways up there in Angola on how you guys can deal with mental health. And I love my key takeaway is mental health is not a luxury, but a priority. So, wow, that one just resonated a lot with me. So, thank you so much. We are just going to go to, seems like he's our final speaker, Dr. Vivek. Here's your question. Yeah, probably I'll check into the chat when we're about to get to our Q&A. So let's keep the chats coming up. I see some positives. So Dr. Vivek, here's your question. Communities are often the first line of response in any crisis. How can local leaders promote sustainable community-based mental health support systems that continue even further after the emergency? Basically, what are the pre and the post-emergency measures that all these stakeholders can take from either community level in terms of responding to crisis and after crisis? Thank you. Your 5 minutes starts now.
Sure. Firstly, thank you for this thoughtful question and for the opportunity to share the space with so many passionate, advocates. I would like to begin answering your question by saying this. When the dust settles and formal aid retreats, it is the local leaders who remain. And these local leaders are the teachers, the social workers, the faith heads, and also the youth mentors. Uh, Mr. Herman Manuel, talked about not waiting for disasters or emergencies, but consider mental health support as a primary care initiative. He also talked about using social media um, and recognizing, the ambassadors or mental health advocates. Malak, Ms. Malak spoke about few programs or organization, is running and, enabling people to speak openly about, any mental health issues. Mr. James mentioned that there are only 110 psychiatrists and one psychiatrist managing about 500,000 people population. And Dr. Kabangu, talked about increasing knowledge and train more people. So uh, one of the reasons why I mentioned about these speakers who spoke before me is because I have something for each one of those points covered in my response to your question. As I, earlier mentioned that local leaders are the one who remain. So they are the emotional architects of recovery. Let's, be upfront about it. Dr. Mr. James, Vetu also talked about the number of psychiatrists, right? So the sustainability of any mental health system depends on how empowered our people are. So I resonate with Mr. Manuel that recognition is the first step. Local leaders already serve as natural counselors and mediators. They know the language, they know the culture, and the trust dynamics of the local people. So, by acknowledging them as key mental health partners, rather than passive beneficiaries, we shift power back to the community. Governments and NGOs can formalize this by including community representatives in disaster management, health planning committees, budget, allocate budget, as much as they, can and wish. But let's keep this in mind that visibility alone turns empathy into influence. So Sustainability requires skill. Imagine if every village, every ward had 10 people trained in psychoeducation or psychological first aid, someone who's able to listen non-judgmentally or de-escalate anxiety or depression and connect with others to help. So this doesn't require advanced degrees. And I'm going back to what Mr. Veto said about the number of psychiatrists available. Just structured, bite-sized training for teachers, health workers, volunteers, and women groups would be sufficient. In fact, in India, my company and my clinic, Pearl Wellness, has embedded microtraining modules that blend certain psychological modalities like neuro-linguistic programming, cognitive behavioral therapy, and community listening techniques, in volunteers, so they become the lay counselors who can help and step in immediately when the crisis really strikes, or not even otherwise, ensuring that emotional bridge begins before professional support arrives. Right. The second is the connection, creating support circles, small groups where people can share experiences, griefs, and hope become safe spaces long after emergency funds dry up. So we should not be, while we ask for emergency funds, I think we should create certain models that even after the emergency fund dries up or before the emergency fund comes, we already have mental health supporters and ambassadors who can aid, in supporting local people. They can be facilitated by training community members, or youth leaders, as I mentioned. So, on this day, I would like to extend my support um, to anybody and everybody, in a part of this conference or otherwise who would like to collaborate. I'm more than happy to extend psychoeducation and training programs, if that's something, that you think is feasible. So such peer models, really don't cost much, but they create a rhythm of collective healing. So it's a proof that recovery is not a program. It's more of a relationship. So for any mental health effort to last, it must belong to the people, bringing back, uh, you know, um, mental health support into the local community. So local leaders can weave the cultural rituals, right? We can bring up art therapy, music therapy, or even storytelling into recovery practices. So these are not soft interventions. They are bridges between trauma and meaning. So when therapy speaks the language of heart, the stigma really melts and participation grows. So we need to make it, more real time and keep it alive. Finally, technology, because world is moving towards artificial intelligence and things like that. So we should build community radio, WhatsApp groups, even simple voice notes that talks about counseling. And these have really helped people in remote areas maintain contact with counselors, either during disaster or otherwise. So, but digital tools succeed only when rooted in the local trust. So leaders should co-own these channels, these groups, these support circles, and help in curating credible content, moderating peer groups, and ensuring privacy and safety of online, therapies, or even, in-person therapies. So, sustainable community mental health system don't begin in boardrooms. It does not remain only with policy creation. They begin in the backyards, in the worship places, in classrooms. So if we equip local leaders with the knowledge, empathy, and the network, they can certainly hold space for healing long after the emergency fades. Because when professionals move out, it's the community that moves on, and how they move determines how the world recovers. So in every catastrophe, buildings may collapse, but community keeps standing. And that's where true resilience really begins. And I would also like to um, submit here and request all the mental health ambassadors to also provide psychoeducation so that our people are able to differentiate between mental health problems, emotional health problems, and psychiatric problems. So if we are able to categorize the the broad base of mental health into mental, emotional, and psychiatric, we should be able to provide them the support that is required at each of these categories and not depend on psychiatrists across all um, the labels that's given for mental illnesses, either as per the DSM, latest DSM, or also as per the ICD-11 or ICD-10 for that matter. So thanks for this opportunity once again, and truly appreciate everybody being part of this conference.
Thank you, Doctor, and great knowledge, because you're right that the community leaders are the ones that actually need to be equipped, and we can't make decisions in boardrooms for the people on the ground without actually integrating or engaging with those at the grounds, because like you said, when all the professionals and the dust settles, the community is the one that moves on. Wow. So wow, I'm just blown away, and wow, thank you. And yeah, I guess people were asking for your credentials, your emails. I think we are going into our Q&A. I see that I'm just gonna take 3 questions, and yeah, some are direct. Maybe I'm just gonna start with the ones that I quickly find. We have Grace with our question. When implementing psychological first aid, PFA, how do you balance rapid response in the need for careful assessment of safety and risk? So I don't know, anyone can take up that question, but they will have 3 minutes to respond. Thank you. That's to our speakers. Unless Grace, you can unmute and then you share your question just for more clarity, and probably direct it to either a speaker that you are asking a question. Thank you. Grace Mshilia. Yes, Mshilia. Hello? Okay, I guess Grace is not around. I will take Bundana's question. It's more direct. It's to Malak. He says, you spoke about the cultural barriers we find, especially when it comes to issues of mental health. In your point of view, do you think these barriers are the ones making our governments not have budgets or programs directed to mental health? If so, what do you think can be done to create a balance? That's Bundani's question.
Okay.
Malak.
Yes, I can answer. Actually, about in our society, I'm talking about Moroccan people going to a specialist when it comes to mental health. It's like doing something that is not unusual for people, and it's people can see you in an not a good way. That's why I told I said that it's a taboo in our society, and I guess it's not just here in Morocco, but it's something really deep in our culture. And I don't think this is the why our government work on it, because they mostly prioritize physical health, and there's no a big knowledge about mental health. Okay, so here in Morocco, we have a real issue with it. Yes, a lot of young people learn from themselves. There's social media, there's articles about mental health, and a lot of information about it. But it's more deep than that. So for us to work on it, it's easy and complicated at the same way because we have the new generation that is aware and the older one that it's not really in a good balance. They are not balanced, they are not going in the same way. The views are different because the need in their period of time was different than the need that we need right now. The needs are different, so they still see that the needs that they have been seeking are not really um, attended attended, so it's hard for them to understand that. And as we know, yes, we talk as a youth in the government about it, but it's still a hard issue to solve. It's still a bit complicated. So I hope I answered your question.
Bundani, are you pleased? And if you so, I think, yeah, that was last. Probably, yeah, I think that concludes everything because I don't see any questions in the chat. Yeah, from there, I just would like to remind people to kindly register. There's a link I shared for Mind Games. They will definitely be giving complimentary assessments and sessions with people that sign up. They had kindly promised around 30 people. So, yeah, luckily we are about 30. So let's kindly sign up for those sessions and, yeah, just equip ourselves because, yeah, the year is ending. There's fatigue, there's everything. And so, yeah, probably just I would like to thank and urge everybody to kindly take care of their mental health because silence really is just gonna cripple you, and until you talk, there will never be peace. From there, we kindly urge everyone to follow Yalda on our social medias. On Facebook, it's on full Yalda Youth Alliance for Leadership and Development in Africa. So just thank you everyone for your chance and everything, your time above all for this informative session. Thank you to our speakers. Thank you to our participants. You guys were really great. So kindly just sign up and yeah, get those free sessions. Thank you. Have a great morning, evening, afternoon, and night based on your time zone. Thank you.